that was Mr. Fadi Harris, our master trainer of Good Morning KSA, where he was actually showing us another set of great exercise. Now, for all those of you men out there who actually do go to the gym, I must say that the exercises that Mr. Fadi Harris is showing you upon the equipment is going to be very much beneficial for you, inshallah, and may we all become the body size and the body structure that we all are trying to attain and achieve now, whatever that truly may be. However, with this, we are going to be moving on towards our very first discussion in the program, which is going to be on the lines of our therapy of dental neuritis. We're going to be learning more about what the neuritis really is. The one thing that we do understand is the fact that it has got to do much with our dental cavity. Now, with this, we're actually going to be moving on with our studio guest, Dr. Husam Mahmoud Khairy. He is a dentist within the Kingdom of Saudi Arabia. So, assalamu alaikum, sir. Welcome to the program.
Welcome. How are you?
We are very well. Thank you very much for joining us. Now, with this, Dr. Husam, we would definitely like to know a little bit about what dental neuritis really is.
Bismillah ar-Rahman ar-Rahim. Firstly, we have to know the tooth composed of what, so we can know what's the dental neuritis.
Right.
Here I got a histogram about this is the tooth, consists of two parts, one part above portion called the crown, and then the lower portion called the root. When we take an longitudinal section in the tooth, we will find it consists of three layers. First layer is called enamel. Can the camera see? Or
Yes, the camera can see.
Okay. This is first called enamel. Here,
okay,
cover the crown, and then we have the dentine. This is second layer. Third, we have pulp chamber, and the root canals have this one called the nerve. So this root canal and the pulp chamber has a bundles of dental nerves. Okay, has a bundles of the dental nerves comes from here, going there and coming back.
Indeed.
Okay.
Absolutely. Doctor, we want you to continue to look at our camera one as you are going to be demonstrating it to our viewers.
Okay,
yes,
thanks very
go
much.
ahead.
Okay. This now in the camera we will say this is the dental nerve. This the dental nerve will come into the dental chamber, pulp chamber, and going back. If the caries of the tooth comes up to here, it's not called this camera.
Yes.
I think this camera.
No, it's that camera. Yes.
Thanks very much. Up till here, it's called only caries. Don't reach to the chamber. If the caries reach to the chamber, now it's called dental neuritis. So, what's dental neuritis? It's inflammation of the nerve inside the tooth, in this pulp chamber and the root canals. That's the definition of dental neuritis.
Indeed.
Okay.
Absolutely. Dr. Husam. Now, Dr. Husam, if you can just turn it a little bit more towards that camera, our viewers will be able to have a more clear view of how it is that our teeth look from the inside and how is it.
Yes, now they can see it perfectly.
Yes. Yes.
Perfect.
Okay.
And that there are a lot of the areas in there which do need attention.
Again.
Indeed.
We will say the dental
yes, please.
again.
Please, go ahead.
No problem. Okay. As we say that the tooth consists of two portions. The first portion called the crown, the second called the root. Okay? Now we know the tooth how. If we take a longitudinal section in the tooth, we will find it consists of three parts. First part called enamel. This is the one with the white color, and secondly with the yellow color, it's called the dentine. The third one called the bulb. The bulb. This is the bulb. Continuous from the crown until the root, with the root canals and the pulp chamber has the nerve inside. So the nerve is not appearing from outside. The nerve is inside the tooth, in the middle. When the caries reaches up to here or here, it's called not called dental neuritis. Until it reaches to the bulb, it's called dental neuritis. It's called inflammation of the dental nerve. Okay.
So now we understand the fact that when the caries reaches to a particular part of the tooth, then it is known as dental neuritis.
That's
okay.
right.
Now,
so it's like, let's say, a deeper version of dental caries.
In the middle of the tooth. Before the middle of the tooth, it's not dental neuritis.
Right.
The things comes from the cold or thermal changes in and in the temperature, it's just called pulpites.
So this is the reason that children have dental caries, but adults, when they would have dental caries, I mean in their childhood and grow up to be adults, it's going to become neuritis.
No, it's not like this. The kids, as the adults, have the dental neuritis. Both.
Okay, by
both
itself
have.
too. All
yes,
right.
both have. Because if the caries reaches to the inner side of the tooth, it will cause neuritis. Whatever it's kid or whatever it's old one.
And is
or
there
adult one.
is there like an expected time in which it gets progressed, Dr. Hussam? Like, let's say if somebody has dental caries and it's left for a couple of years untreated, is when it's going to be going deeper into the teeth and would even start to affect the nerves? Or is it by itself that you could be acquiring dental neuritis?
No, no, it's not by itself at all. We have to say, if you can go to the dentist every 6 months, it's very good. You can attend the dental caries before it reaches to the inner part of the tooth. So until it reaches to the inner part of the tooth, it's only regular filling. Means only removing the decay and the caries, and we will fill. But after it reaches to the inner side of the tooth, we have to make another procedures at all. It's called root canal therapy. Means taking the nerve out of the tooth.
Right. Now with this, Dr. Sam, we actually understand that whenever it is that we are having some sort of a tooth sensitivity, we are having some kind of a dental problem.
Right.
What are perhaps the symptoms that our viewers, if they're having any sort of a tooth or dental problem, they can perhaps put a finger on it that maybe these are the symptoms for dental neuritis?
Okay. They are both 2 or 3 symptoms most important for all people to know. If he has a headache here, or he has a pain all over, here. Yes, or he has a pain all over the branch of the nerve, all over. He can feel even up or down. He can feel in the upper region or the down region. He comes to say, I have a very headache here. I can't sleep at night.
In a particular side.
Yes, this is called dental neuritis.
Is it on both the sides or only one side?
Only one side. Only the side of the tooth infected, not the other side.
Oh, okay.
Because there are 2 branches of the nerves, here and here, not the same branch. So before he reaches to this one, he cannot have dental neuritis. It's already regular filling. But if he reaches this point, he must go to the doctor to make root canal therapy. And the temperature, the severe sensation of temperature between the cold and hot things, this must be also do right canal therapy.
Oh, if you feel like, let's say when you're eating something very hot or drinking something very hot or cold, it should not affect your teeth at all, is what we understand.
At all.
But if it does, even to a certain extent, you have to go to a doctor.
Yes, it has to be. Not a certain extent, even if it's persistent. Not just come and go. If it's persistent, you have to go to the dentist. Okay.
Right. Now, doctor, we understand that many a times, like for our people who are watching us, I'm sure most of the people who are watching us right now have not really gone to a dentist in the last 6 months. That is something which we wait. We wait till our tooth is falling or we have some serious problem to go to a dentist.
Right.
Now, how is it that perhaps we can try and prevent dental neuritis from happening? Is there a possible way that we can perhaps take care of our teeth in a way that it will not become so severe?
Of course, Prophet Muhammad says from 140 centuries, the swag. Swag means to brush your teeth, even he says 4 or 5 times a day in the bray. With the modern scientific words, we will say only the brush. You can do the brush for 3 or 4 days with the mouthwash. Brush, mouthwash. Before all of this, good nutrition. That's what I want to say to the to the fathers. Good nutrition for the kids. Now we have our kids, what they eat in the morning? Sandwich with what? With Pepsi, with cans, with so on. And this is very dangerous to the tooth. So good nutrition with all foodstuffs and with all natural foods, very, very healthy for the tooth. Then we have to do the regular things from cleaning the tooth with the toothpicks or mouthwash and so on.
Indeed. Now, Dr. Hussam, as I always say, that it happens to everybody psychologically. Whenever it is that they're hearing about something, a dental condition, a medical condition, they start to think that they have it as well.
Right.
Oh, yes, I felt that
I
4 weeks
feel
ago.
it.
Oh, I felt that
Right.
3 days ago. So the same thing happens. Right now, it's
Right.
psychologically happening to me as well. Oh, those 4 days ago when I was drinking a room temperature glass of water, I felt something hitting my teeth the moment I gulped it. So do I have dental neuritis?
Ignorance
I
or
think
not?
that- yeah. So tell us, please, Dr. Hussam, is it something that has to be repeated, like every time somebody is drinking something warm, hot, cold, or even room temperature, if it hits their teeth, if they feel a sensation, is when they should really consider it? Or if it's just once in a while, they can perhaps ignore it?
If it, just like you say, this is a good question. If it happens once for a while, okay, ignore it. But if it's persistent, if he drinks today and the next time and the next time, so he must go to the doctor. 3 or 4 things we have to run to the doctor, to the dentist. First, if we got a trauma, even if there is no symptoms or signs, because the trauma makes a collection of blood inside the tooth, in the bone, so it must be go to the doctor to make root canal therapy or whatever the procedures you will do. The trauma, the sensation of the change of the temperature, whether with cold or whether with hot, or the caries. Even if you take a sweetie things, you know, sweetie things, any sweet things you take and you feel something eliciting like pain, you have to go to the doctors, to the dentist, because sure, there is caries inside the tooth that feels you the pain. This is from God gifts to us. There is a nerve, there is a sensation. So it's just like any organ of us, any organ in the body. If he feels any sensation, you have to go to the dentist to see to him what I am feeling, what's the problem. That's
Indeed,
right.
to find out what is happening in there, the places where you really cannot even see. But also, Dr. Hussam, some of the people, they have spaces and gaps in between of their teeth. Now, are those people also susceptible to dental neuritis?
No, it's not like this, because the gaps can be natural.
Yeah.
Prophet Muhammad sallallahu alaihi wasallam was gaps, there is gaps between all of his teeth. But if the gaps with the caries inside the tooth and the caries in between the tooth, this is the one who makes the gaps, now you have to go to the dentist, because this caries will continue until he will make, he will pierce the dental bulb, and if he will pierce the dental bulb, you have only two procedures to do, either to extract the tooth at all, and that's not forbidden, you know, this is not likely, you know, or you do root canal therapy, you treat the tooth. So these gaps between the tooth must be cleaned at all times, 4 or 5 times a day with mouthwash, so the foodstuffs will not collect between the tooth and make the caries and so on.
Indeed.
Right.
And now, Doctor, for the people, let's say, who consider their dental health, how often, as you said, like 6 months, every 6 months they should be going to the doctor to have a regular checkup. Now, let's say I come to you now, and you
Inshallah
tell me...
not. Inshallah not.
Inshallah not. But a
Yes.
lot of the people who are very conscious, they like to go before they have a problem.
Yes.
So if I come to you now and you tell me that, no, Simon, you have perfect teeth and you don't need anything, no dental conditions, no complications. Now, is it still necessary for me to revisit you after 6 months, or that I can let it rest?
No, of course you have to come again in next month, in 6 months more, because you cannot know when the foodstuffs will collect, make debris, make caries, and so on, the tooth will go away. You don't know when this will happen. So the regular examination of the teeth every 6 months avoid you all of these procedures you don't need.
Right. Now, Dr. Hussam, with this, one thing that comes to my mind, I've been constantly
course.
staring at the teeth structure. And
Okay,
I
I'll take it out. No problem.
I've been looking at it, and I see there is like a color difference in the gums.
Yes.
Where some part of the gum is the normal, healthy-looking pink, and another
Purple.
part is inflammation, some sort of an inflammation that we see in that tooth structure. Is this another symptom for dental neuritis? Is this one of the diagnoses that we can do ourselves, a physical change that we can see?
You see, you will know the teeth or the gingiva, if it's inflamed or not, by a simple thing, it will become red, more redness. The regular gingiva, the healthy gingiva, is purple in color. not another color. It's purple in color. When it turns to red, that means there is a blood coagulation or a blood collection in this area. That means there is inflammation. You have to go to the doctors or the dentist, so he will make you only curettage or something and clean this area. And if you feel after this with cold or hot, as we say, is cold or hot things or another symptoms, you have to know that there is something inside the tooth you will have to make.
Right. Another thing that comes to mind, Dr. Mohammed, is the fact that, yes, because I have been trying to get myself into a dentist chair for a very long time. So yes, I'm always very concerned about it. But the one thing that we often see is the fact that many people, they complain about sensitivity. Right. About tooth sensitivity, they complain about it like every time that they eat. Even when they drink normal water, they complain about some sort of a tooth sensitivity. Now, many a times we understand that once a root canal is done, which is perhaps the treatment for neuritis, is when people have a little more sensitivity than before, once the root canal is done. So what is perhaps the time that, is there another treatment other than the root canal? Because at times, like the root canal is just a little scary, the procedure. So is there any other treatment for neuritis other than root canal?
Okay. You says all of things in one question. No, the sensitivity for 4 or 6 reasons, and not all needs to do a root canal therapy. For example, if you have a denuded roots, what's meaning of denuded roots? Gingiva must be cover the root, the whole root, and let the crown above that we have to say, we see in the mouth. But if the gingiva is recessed down even 2 millimeters, you will have very sensitivity. This is called from denuded root. Means the root has see the air and didn't do it like this. It's closed in the bone, and after the bone, the gingiva. When they see the air affects very much in these areas in the denuded roots. So in these cases, you can make another procedures not to do root canal therapy. But if the pain is too much, you have to do root canal therapy. This is the last thing you do. The root canal therapy in one tooth. This is what we say about, it's not in all the teeth. It's only in the infected tooth, not all the teeth. So if you have another tooth feeling another symptoms with the sensitivity, you have to treat it. Not the same tooth, you treat it very well. You do root canal therapy. And if you do a root canal therapy, from the first day, sure, no sensation.
No sensation?
At all. You take out the nerve, so how can you feel? The nerve is responsible for sensation. You took it out.
But isn't
there is no nerve in the tooth.
Isn't root canal very hurtful?
No, at all. Really.
If you have a good dentist, that
not a good dentist. It's not like this. But thanks to the procedures of the science, now there is a lot of things we do. The patient does not feel at all in the procedures of the root canal therapy.
So is it done under anesthesia, Dr. Hussam?
Yes, of course. And this is.
So it is painful, but it's not painful because of anesthesia.
Not like this. Yes. The local anesthesia, up till now, we do local anesthesia, of course, not general anesthesia, as we do in all our procedures for the mouth. But up till now, in the 20th century, there is nothing we do except the injection. Up till now, we take the injection, the scare injection, that the people feel of terror for the injection. But nowadays, we have a topical gel anesthesia. This topical gel anesthesia we put before the injection. So the patient does not feel the puncture. Yes, the patient does not feel the puncture of the needle.
Oh, yeah.
Nowadays. This is the scary thing, you know.
So this is like a gel-like substance that you put on.
Of course.
Okay, because the last time that I had to get a glucose drip and they put like, you know, this particular cream on my hand, a part of my brain was telling me that, okay, I think that this is going to be an anesthetic, and when they put the IV, I would not feel the pain.
Right.
But this is the first time that I find out that, okay, it is actually true, and it is.
It's actually do. And in the tooth, it's very do. Just 2 minutes. We put the topical gel anesthesia and let it for 2 minutes. Then we puncture the needle. The patient does not know at all, does not feel at all.
Doctor, let me ask you this, because you said that it's very important for everybody with healthy teeth or with unhealthy teeth to visit doctors, dentists every 6 months. Now, I'm not going to ask you for any of the prizes or so, but just give me a rough idea. If somebody comes to visit a doctor 2 times every year, does that cost them more money than a root canal or less money than a root canal?
Very good question. Thank you very much. You have to only, you will pay only the examination, and this is, you will pay whether you have things or not. After the examination, if you have only a little caries, so the cost will be a little because it's only a regular filling. You will remove the decay and put the filling. So this is costing less, very less money. But if you let yourself until the decay or the caries reaches to the bulb and you do another procedures, that is the one you call the root canal therapy, at least 3 times as you paid before. 3 times.
Wow.
So go, hurry to the dentist. If a little thing, you will pay a little. If too much trouble the case, you will.
And given if you have to do a root canal, and that is when you start thinking about your budget and negotiating and bargaining and going to a dentist who is maybe not really very good by saving a little bit of money, compromising on the doctor, compromising on the hospital or the clinic you are going to, you could only find yourself all the more in trouble. So please, please always go to dentists who you hear reliable, good things about from your friends, from your relatives, as well as doctors who are practicing in reputed hospitals or in reputed clinics as well. These are the things which are very important, because a lot of the times people do the damage, Dr. Hussam, and then when it comes to the time of root canal, and root canal is actually a serious dental surgery, is when you start negotiating. So this is really, really something very bad, and we really have to be thinking about it.
This is, of course, we have to say to the people, we are the dentists suffering from this, because it comes in the last procedures.
Yeah.
The last procedure, even if it's not reaches to the bulb, the caries didn't reach the bulb, and he comes suffering too much pain. No, the tooth is totally fractured. You have this wall fracture, you have this wall fracture. So after the root canal therapy you have to do another procedures. You have to put something solids, and you put a crown on the tooth so it will not completely fracture. So please, please, every 6 months checkup. You will save a lot of money, you will save a lot of pain, you will save a lot of effort. Do every 6 months checkup, only regular checkup.
Now,
that's very good.
Doctor, another thing that comes to mind is the fact that there's so many people that we get to see who have got braces or who've got some sort of an artificial aesthetics on top of their teeth over the natural teeth. Now, what if neuritis takes place when you are already having something artificial on your teeth? What happens then?
It's according to what's artificial. If the braces only, it's a regular thing. We can work in spite of presence of the braces.
Okay.
But if there is a crown, there is a problem, a huge problem. You have to take out all the crowns, and you will make root canal
How do you
therapy.
take the crown off? Do you break it?
A lot of procedures. Sometimes you have to break it. Sometimes you take it out with another instruments and so on. Don't be afraid. Just come and I'll do everything you want.
No, thank God I don't have any crowns. So with the braces, the procedures can be done.
Yes.
But if there is like an artificial crown, then it cannot be done.
Now, can be done, but we have to throw this crown. Sometimes you cannot take the crown out, so we cut it into 2 halves and take it out. Khalas, finished the crown. So after we take the crowns, we can make procedures. We can make root canal therapy. It's not a problem.
Right. And doctor, once this procedure is done, let's say somebody had neuritis and they got it treated with the root canal.
Good.
Now, what is it that they should try and do then? Because then the procedure is already done, they don't really have any pain, and the problem is over with. How is it that they should perhaps keep up with the care for their teeth?
After we finish the root canal therapy, and by the way, I want to tell you, in the first visit, the pain is off. That's the very good thing in the root canal therapy. With the first visit, the pain is gone away. So after you finish the whole procedures for root canal therapy, you have to make a crown, because as we told before, the pulp tissue or this inside the tooth make the moisture and make the softness of the tooth. After it takes away the pulp tissue and so on, it becomes hard. So any pressure on the tooth after it made a root canal therapy, it can be fractured, really. So it's advisable and very good will to do after you make a root canal therapy. Just cover it with a crown. If you cover it with a crown, the pressure will come through the crown, so the tooth will be maintained as itself for a long time, for all the time, inshallah.
Inshallah. And well, with that great message, we are going to be thanking you so much, Dr. Hussam, for keeping up with all of our questions. And ladies and gentlemen, we honestly hope that you've got to learn a thing or two about your teeth. And regardless of what your condition is, please go to the dentist, visit the dentist. With this, we'd really like to thank Dr. Hussam Mahmoud Khairy. He is a dentist who is joining us in the program to raise more awareness alongside Good Morning KSA. For the moment, let us move on towards a break in the program, after which we're going to be coming back. We are going to be moving on towards our Time to Focus segment, in which we're going to be focusing on the media broadcasting forum, which was held over here in Riyadh. Stay tuned.
Mr. Maheen, we'd like to ask you, what's the main goal of this forum?
Well,